Hey everyone. If you haven't figured out by now, this podcast is all about countertransference. And what I mean by that, for those of you who may be listening and aren't in the field of social work or psychotherapy or psychology, it's basically about understanding what is going on with us as the social worker or the therapist in terms of our emotional reactions and responses to those we're working with, so that we don't project our own feelings onto those that we're working with. And so this profession calls for continuously striving to self understand as best we can. And I know that we think that this is all about the clients and it shouldn't be about our stuff, and that is true. But how do we really ensure that it's not about our stuff unless we are very clear on what our stuff is and when it rears its head? So today I wanted to talk about the vulnerability on the part of the social worker in doing this work because of the high demand to consistently and persistently look at ourselves and understand why we are doing the things we do, acting the way we do, and feeling the way we do, so that we can best be in service to those who are seeking our help. So, if you are of this belief or you want to become more self actualized, is that's what we would call it, self actualized, or really, I think, just being motivated and interested in ourselves so that we can grow personally as we're growing professionally, and absolutely grow professionally as we are growing personally. So let's talk about vulnerability and what that really is about. I'm sure you may be aware of Brene Brown, who is a researcher and social worker who has spent her career trying to understand vulnerability. And basically, she says that she has spent a lot of years trying to outrun vulnerability. And why? Because it's not always fun. Being vulnerable means being seen. It means being exposed. It means taking risk. It means that there is potential for us to be hurt, that there are shameful feelings that we carry with us, and we don't want to be seen. So more and more, I am of the belief that nobody makes it through this life without being traumatized on some level. Now, it can be a brief traumatization or it can be a long-standing traumatization. There's all different degrees of trauma and intensities of trauma. And some believe that maybe it's dependent on the actual event experienced, but I would also contend that it has a lot to do with our ability to cope and the variations in our abilities to contend with that traumatization. So Brene Brown says that of all the things trauma takes away from us, the worst is our willingness or even our ability to be vulnerable, and that there's a reclaiming that has to happen. And I would certainly agree with that. And I think that that's one of the things that drives us into this profession, our own trauma and our desire to help others with their trauma, but also often unconsciously, our need to work through our trauma, which happens kind of vicariously through helping other people with their trauma. So I present to you or pose the question to you, what is the hardest thing about being vulnerable? What is your biggest fear about being vulnerable? As with most things, there are some commonalities for all of us, but there's also some unique aspects of what you feel is difficult about being vulnerable. As I said, you're going to be seen, you're going to expose a part of yourself. It requires taking risk, and it requires potentially feeling hurt or shamed. But for you, it might be a compilation of these things. It may be only one of these things. It might be something completely different. Pause for a moment and consider, what is it for you? Because I want to say that the goal is not to avoid vulnerability, though that is what many of us attempt to do. We don't take risks. We don't put ourselves in positions that are going to make us feel less than or feel threatened or just plain uncomfortable. So I'm going to say it again. The goal is not to avoid vulnerability. The goal is to push through it. Now, the fundamentals of social work practice include the ability to think critically, which means thinking about things from multiple lenses, not just our own perspectives, not just trying to understand the perspective of that person before you, but considering multiple lenses through which to view the same issue or topic or subject. Um, Another fundamental of social work practice is knowledge building, right? We got to get familiar with the issues at hand, with the people or the populations that we're working with and what they are contending with. And again, we have to build our self-awareness and our ability to self-reflect. Now, countertransference has a lot to do with feeling vulnerable and thinking about how that feeling or feelings that we have, those fears that we have, influence so much of our actions or our inactions. There are reasons why we don't do certain things, why we steer clear of having certain interactions or experiences. They're usually laden in a history of discomfort with that experience, or certain types of people or certain personalities. And part of becoming familiar with our countertransference means that we are going to become better able to work past these things. So I would say that in order to become a really good social worker or a really good therapist, you have to work through, be willing to, or are currently working on your own inner processes. You have to understand your own thoughts, your own feelings, and your motivations that lead you to respond to other people or intervene in the way that you do. So how can you do that? First of all, I believe that every practicing therapist or social worker, even though it's not mandated by BSW or MSW programs, should be in their own therapy. How are you making determinations on what is best for your clients, in addition to evidence-based practices, of course, but in terms of that part that's also the art, which is based on our intuition. And if you are solely driven by your own intuition, can you make sure that you're doing that not based on what has worked for you or what you think is best, but obviously what is going to be best for the client? And in order to do that, we have to be able to kind of step back from our own processes and understand very clearly what our motivation is, where it's coming from, whether it's from our own history, our own belief system, our own value system, and make sure that that is not what is solely driving us, but what is best from an objective point of view for the client. So it also requires reflective supervision. Being a really good social worker requires having supervision that's going to help you look at yourself in addition to what's happening with the client, as well as your responses to the client. You have to also be able to accept mistakes. If you don't see mistakes as failures, but rather as learning opportunities, you are going to be well positioned to be more vulnerable, to make interventions that are new to you, that are not just safe and familiar, because this is not a one-stop shop. This is why there's not a book of golden rules, because each client before you, even though they may be from a familiar population or from a familiar social issue that you've worked with before, is made up of their own temperament, their own defense mechanisms, their own pathology, their own dynamics, and we have to get comfortable being more flexible in the way that we're working. And in order to do that, we have to take risks, and we have to be willing to make mistakes, and we have to be willing to see how our interventions or the skills that we're using are landing. And that means being able to read the client's response to us and not taking it personally. And again, not seeing it as a failure, because that's when your vulnerability is getting in the way. So if you can accept feedback, either from a supervisor, a colleague, a peer, or your client as critique rather than criticism, then you're going to be better positioned to be better at what you do. You know, Brene Brown says that our call to courage is to protect our wild heart against constant evaluation, especially our own. And the truth is that it's our own evaluation, perhaps that has been internalized from others, but that often is um, signifying a very harsh superego. And if you consider that you're harder on yourself than others, then you can then move to being better positioned to accept feedback because the other person is seeing you for your strengths and not for what you're not doing. You're doing that part to yourself. So again, the goal is not to avoid vulnerability. The goal is to push through it. And we have to be able to take feedback because if we can accept feedback, we are better armed to provide it. And part of what we have to do in our job is to provide feedback to others. If we over-identify with the clients and assume that they are going to be hurt or feel criticized by our feedback, then we are doing them a disservice in not providing it to them. We don't want to hurt them because we assume that they're going to feel as we feel. But mastery requires feedback. And I don't care what you're trying to master and whether you're trying to develop greatness or proficiency, says Brene Brown, but it always requires feedback. I always say that there's a lot of skills that we need in order to be in best service to our clients. For instance, how are you going to identify a client's strengths if you can't identify your own? I often have students do an exercise where they write down a list of their strengths, and then they write down a list of their limitations or things that they need to work on. And inherently, the list of what they need to work on exceeds their list of strengths. And what does that say? That says, because it has come from our discussion around this, that one, it's easier to see one's limitations than strengths. And this is kind of a poor commentary, I suppose, on our culture. The other is that it's seen that if we identify our strengths, and there's too many of them, we might be seen as being, as having bravado, as bragging. And I really want to nix that and say that all the power to you if your column of strengths is bigger than your list of limitations, because this means that your self-esteem is intact, that you know what you have to offer, that you own that, and that you are proud of that. So if you struggle with that, it's something you need to work on, because again, how can you help identify the strengths of others if you can't identify your own? In order for you to advocate for others, to be really good at that, you have to be able to self-advocate. And also, if you're helping somebody self-advocate, you can't really be effective unless you've had that experience with yourself. You have to self-soothe in order to be able to soothe other people. You have to be able to depend on others and not see that as something negative in order to allow people to depend on you. So basically, the idea is that anything I'm asking of you, I have to be able to do, or at least be willing to do. And certainly at the top of that list is being vulnerable. You are welcoming clients into your office. You are welcoming clients to share their most private emotions with you. You are, in essence, asking them to be vulnerable and expecting that they're going to come in being vulnerable because you have extended your hand or your heart. And if you haven't had that experience of exposing yourself in a similar way, is it fair to ask that or expect that of your clients? Might you be a little blocked in terms of understanding how difficult it is for them in really, really getting in touch with that empathy of what it's like to come to someone you barely know, at least in the beginning of that relationship, and share their vulnerability? Now, I've given you some practices, right, in terms of supervision, in terms of therapy, and I would also add a peer supervision group. Any opportunities you have to talk about cases that you're working with and also talk about yourself is an opportunity for you to grow through your vulnerability. And I would add that I would like to um, have this podcast be a tool as well for growing one's vulnerability. I think that each episode that focuses on everything from engagement to assessment to intervention, boundaries and self disclosure, and our personal biases and the challenges we may have in supervision, and our failures and successes in client attunement, our ability to confront or our challenges in confronting, managing group dynamics and discussing ethical dilemmas. All of these things I have hoped are talked about in a way where myself and the guests that are appearing are looking at their countertransference as they move through these common issues that come up when working with others. You know, in episode 46, we talked about when your client professes their love for you. And I have seen when I have used this episode as a discussion tool in my class, students are terrified of the idea of clients saying they love them. And of course, it's scary, but we look at what this brings up in the burgeoning social worker. What is it like to be told that they are loved? And of course, it evokes fear. And the fear is based on the idea that this is a professional relationship and that's not appropriate. And we're not supposed to accept those kind of affirmations or declarations from our clients. And the reality is that if somebody understands what their fear is in regard to hearing this from a client, then they can work through that better with the client rather than shutting a client down and telling them, you know, that's not really appropriate, or we're here to focus on you, or whatever the initial response may be. What might be more therapeutic is to understand what this love represents. Because oftentimes, for example, it's very seductive to have somebody, that social worker or therapist, who is listening to you without judgment, who is consistently attuned to you, who is here for you, who is trying to understand you. Who wouldn't fall in love with their social worker? So, you can think about how rejecting that may be if you're not attuned to yourself and trying to understand where that comes from. Um, in episode 47, for example, I spoke with a social worker who has been through the foster care system himself as a child and as a young man, and how influential that experience was. And thankfully, it was a very positive experience, unlike what we hear about foster care and the foster care system. And how does that experience arm him with the ability to work with other people who have very in episode 49, we talked about reflecting on the benefit of silence and ways to offer empathy. And my guest dug deep to understand what was difficult for them in sitting in silence. And why is this important? Because sometimes clients need space to process their feelings. And if we have an intolerance for being in silence and it makes us anxious, then we are not providing what our client needs. So again, what gets in the way? What is it like to sit in that silence? And what gets in the way of offering empathy? Why is there this need to provide a silver lining? Why is this a need to self-disclose and show the client that you understand by relating something similar that may have happened to you? Is this in the best interest of the client? Sometimes, I'm not going to say always no, but how to make that distinction between what is in the best interest of the client and what is coming from our own needs is the crux of the work. And this goes for episode 51 too. Also, we talked about advocacy and confrontation and how to get your needs met. And how many people are scared of confronting other people and how much they associate that with anger or hostility. And so what's the tendency? The tendency is not to get what you need, because asking for it may result in rejection. It may result in disappointment. And these are feelings that make one feel very vulnerable. So let's understand, what is your anxiety about asking for what you need, and all of these pieces of the work that are so important. I can't help but think about episode 53, which is called Don't Be Mad at Me, and dealing with client hostility. And it kind of ties back into this idea of having a really hard time with anger directed at oneself from another. And even though that's a common feeling, and we can be soothed by knowing that, not just soothed, validated, and knowing that other people share the same experiences, it's still important to work it through, because sometimes clients need to be able to share their anger, whether it is directed at you or not. But if you can't sit with it and you can't tolerate it, then you may try to find certain ways to appease them so that they don't express that anger. Or you might be implicitly sending messages to them that it's not a safe place for them to express themselves, or that you're not able to hold their emotions for them. And that's part of the job as well. So you can start to see how important it is to get in touch with all of the things that make you feel so vulnerable. So I'm going to paraphrase something that Brene Brown says, and it's about the idea of choosing courage, because vulnerability and addressing it does take courage. So if you do choose courage, you are going to know what it feels like to be disappointed, to have a setback, maybe even heartbreak. But that's why it's called courage. And that's why it's so rare. And that's why I am encouraging all of you who are listening to push through your vulnerability and to dare greatly. So how are you going to do that? How are you going to push through your vulnerability? Are you going to do any of the things that I suggested, whether it's going into therapy or continuing with the therapy that you're in? And congratulations for doing so. Whether it is continuing to have supervision, even when you're no longer a beginner. Is it by joining a peer supervision group, or making time on a weekly basis to discuss a case that you might not be doing so well with? Right? We have a tendency to want to share or process that which we're feeling confident in, but maybe have a question about. But what about the ones that you really feel like you are messing up? Maybe you're going to come on this podcast and be my guest, and we're going to talk about your countertransference. I'd love to know what you're going to do. So please feel free to post that. You can do that on my Facebook page. You can do that on my Instagram page, and you can do that on Spotify. So I wish you all to take a step towards your future, and a better future, because I can tell you very personally that the more that I allowed myself to be vulnerable, the greater satisfaction I have, not only in my work, but in my personal life, and the greater growth that I have done. And it's a lifelong trajectory. It's never going to stop, because I don't want to ever stop growing.